Seniors, if you're over 65 and trying to force your blood pressure down to a perfect number, this video could protect your life. For years, we've been told that lower is always better. But new evidence shows that for many older adults, blood pressure that's too low can increase the risk of dizziness, dangerous falls, broken bones, and loss of independence. I've seen seniors follow their doctor's advice exactly, and still end up in the emergency room because their blood pressure was pushed too low. Today, I'll explain what the best blood pressure really is for older adults, and why the truth is very different from what most people believe. Why 120/80 became the gold standard, and why it may not fit seniors. For decades, you've probably heard the same message over and over again. 120/80 is the perfect blood pressure. Doctors memorize it, health websites repeat it, and many seniors are told to chase that number at all costs. But here's the truth most people never hear. That number was never designed specifically for older adults. It was based largely on studies involving younger and middle-aged adults, people whose blood vessels are more flexible, whose balance systems react faster, and whose bodies can safely tolerate lower pressure. As we age, something very important changes. Our arteries naturally become stiffer, our nervous system responds more slowly, and our bodies depend on slightly higher blood pressure to keep enough blood flowing to the brain, especially when we stand up. So, when an older adult is pushed down to a perfect number that worked well at age 40, the result can be lightheadedness, blurred vision, or sudden loss of balance. And that's where the danger begins. Because for seniors, the greatest risk is often not a heart attack, it's a fall. A fall that breaks a hip, a fall that requires surgery, a fall that permanently takes away independence. Yet many older adults are never warned that lowering blood pressure too aggressively can increase these risks. In just a moment, I'll share a real story about a senior who did everything right, followed medical advice perfectly, and still suffered life-changing consequences. But first, you need to understand why the same blood pressure target does not work the same way after age 65. A real story. She did everything right and still fell. Let me tell you about Margaret. Margaret was 78 years old. She lived alone, managed her own home, and still drove herself to the grocery store every week. Like many seniors, she valued one thing above all else: her independence. At a routine medical appointment, her doctor noticed her blood pressure was slightly higher than expected. Nothing alarming, nothing urgent, but it was enough to raise concern. To be safe, her medication was adjusted to bring her blood pressure closer to what was considered ideal. At first, everything seemed fine, but within a few weeks, Margaret noticed something new. When she stood up from a chair or got out of bed, she felt a brief wave of dizziness. Just a second or two. A lightheaded feeling. A moment where she needed to steady herself. She told herself it was probably nothing. Later, she mentioned it to her doctor. She was reassured that can happen when medications are adjusted. She was told, "Your body will adapt." So Margaret did what she had always done. She trusted the advice. She took her medication exactly as prescribed. She didn't skip doses. She didn't complain. Then one morning, everything changed. Margaret got out of bed and started walking toward the bathroom. As she stood up, the room suddenly spun. Her vision blurred. Her legs felt weak. Before she could grab onto anything, she lost her balance. She fell hard onto the floor. Margaret fractured her hip. That single fall marked the beginning of a long and difficult road. She needed surgery. Then weeks of physical therapy. Simple tasks, standing, walking, bathing, became exhausting challenges. Although she worked hard to recover, Margaret never fully returned to the life she had before. Here's the most important part of her story. Margaret didn't fall because she was reckless. She didn't fall because she ignored medical advice. She didn't fall because she was unhealthy. She fell because her blood pressure was lowered too much for her aging body. As we get older, the body's ability to quickly adjust blood pressure becomes weaker. When a younger person stands up, the body reacts instantly, tightening blood vessels and maintaining blood flow to the brain. But in older adults, that response is slower. If blood pressure drops too low, even for a moment, the brain may not receive enough blood. And when that happens, dizziness, instability, and falls can occur in seconds. Stories like Margaret's are not rare. They happen quietly, every day, to seniors who believe they are doing the right thing. In the next part, I'll explain exactly what changes inside the body after age 65 and why older adults often need a different blood pressure target than younger people. What changes inside the body after 65? To understand why blood pressure targets change with age, you need to understand what happens inside the aging body. This has nothing to do with weakness. It has nothing to do with failure. It's simply biology. First, let's talk about arteries. When you are younger, your arteries are flexible. They expand and contract easily, helping blood flow smoothly through the body. As you age, those arteries gradually become stiffer. That stiffness means the heart has to push a little harder to send blood where it needs to go, especially to the brain. A slightly higher blood pressure can actually help compensate for this stiffness. Lower the pressure too much, and blood flow may not be strong enough. Next, there's the nervous system. Your nervous system controls how quickly your body reacts when you change position. When a younger person stands up, sensors in the body immediately detect the change. Blood vessels tighten, heart rate adjusts, blood flow to the brain is maintained. In older adults, this response is slower. That delay may only last a second or two, but that's all it takes to feel dizzy or lose balance. This is why many seniors experience lightheadedness right after standing. Now let's talk about medications. Blood pressure medications often work more strongly in older adults. The same dose that gently lowers pressure in a 50-year-old may lower it too much in someone who is 75 or 80. This is especially true when multiple medications are taken together. The result can be blood pressure that looks good on paper, but feels very different in real life. Here's another factor that's rarely discussed: hydration. Older adults tend to feel less thirsty even when the body needs fluids. Mild dehydration can further lower blood pressure, especially when standing. Combine dehydration with blood pressure medication and slower reflexes, and the risk of dizziness increases even more. All of these changes add up: stiffer arteries, slower nervous system responses, stronger medication effects, less margin for error. This is why a blood pressure number that feels fine for a younger adult can be dangerous for an older one. And this is the key point. For seniors, stability is often more important than a perfect number. Avoiding dizziness, avoiding falls, maintaining balance and independence. Those goals matter just as much, if not more, than hitting an ideal target. In the next section, I'll explain why chasing very low blood pressure numbers can increase fall risk, and why many experts now believe blood pressure targets should be adjusted after age 65. Why lower is better can be dangerous for seniors. For many years, the message around blood pressure has been simple: lower is better. Lower numbers were believed to reduce the risk of heart attacks and strokes. And for younger adults, that idea often holds true. But for seniors, the situation is more complicated. When blood pressure drops too low, the body may struggle to deliver enough blood to vital organs, especially the brain. This problem becomes most obvious when changing positions: standing up from a chair, getting out of bed, reaching for something overhead. In those moments, blood pressure can fall suddenly. If it falls too far, even briefly, the brain does not receive enough oxygen-rich blood. The result is dizziness, weakness, or a sudden loss of balance. And for older adults, those moments can be dangerous. Falls are one of the leading causes of injury, disability, and loss of independence in seniors. A fall does not need to be dramatic to be life-changing. A simple slip can lead to a broken hip, a broken wrist, a head injury, and recovery is often long and difficult. Here's what many people don't realize. Studies show that very low blood pressure in older adults is associated with a higher risk of falls and fractures. In some cases, seniors with slightly higher blood pressure actually fare better because their brains continue to receive adequate blood flow. Another overlooked issue is overtreatment. As guidelines change, medications are sometimes added or increased quickly. Blood pressure may look excellent during a seated office visit, but no one checks what happens when the patient stands. This can create a dangerous blind spot. A senior may leave the clinic with perfect numbers and still experience dizziness or near fainting at home. And many seniors don't report these symptoms. They assume dizziness is a normal part of aging. They don't want to complain. They don't want more medications or tests, so the problem goes unnoticed. Here's the key takeaway. For seniors, the goal is not the lowest possible number. The goal is a blood pressure that is high enough to maintain brain blood flow, stable enough to prevent dizziness, safe enough to reduce fall risk. This balance is different for each person, and that's why using one universal target for all ages can be dangerous. In the next section, I'll explain what blood pressure ranges are often considered safer for older adults and why these ranges depend on age, health, and daily function, not just a single number. Safer blood pressure ranges for older adults, not one number. Now let's talk about the question everyone is waiting for. What blood pressure is actually safest for older adults? The first thing you need to know is this. There is no single perfect number for every senior. Age matters. Overall health matters. Medications matter. Daily activity level matters. That's why experts now focus more on ranges, not one strict target. Let's break this down in a simple way. For many healthy adults over 65 who are active, steady on their feet, and not experiencing dizziness, a systolic blood pressure, the top number, often falls somewhere in the 130 to 140 range. This range is often high enough to maintain good blood flow to the brain, while still offering protection for the heart and blood vessels. For adults over 75, especially those who move more slowly or have balance concerns, a slightly higher range may actually be safer. In many cases, a systolic pressure in the mid-130s to mid-140s can reduce dizziness and fall risk. Now, let's talk about very old adults, those in their 80s and beyond. For this group, stability often matters more than hitting a specific number. A blood pressure that avoids sudden drops, prevents lightheadedness, and allows safe movement is often considered more important than aggressively lowering readings. That does not mean ignore blood pressure. It means individualize the target. Here's another important factor. Symptoms. Two seniors can have the exact same blood pressure reading and feel completely different. One may feel fine, the other may feel dizzy, weak, or unsteady. In older adults, how you feel matters just as much as the number itself. If blood pressure medication causes frequent dizziness, near fainting, or balance problems, that is a warning sign, even if the numbers look good on paper. Another key point is consistency. Blood pressure that swings up and down throughout the day can be more dangerous than blood pressure that stays slightly higher but stable. Large drops, especially when standing, increase fall risk. That's why many clinicians now recommend checking blood pressure not only while sitting, but also after standing. This provides a much clearer picture of real-world safety. So here's the takeaway from this section. The best blood pressure for older adults is one that supports balance, brain blood flow, and daily function, not just a textbook number. In the next part, I'll show you a simple test you can do at home to see whether your blood pressure may be dropping too low when you stand up and when it's time to talk to your doctor. A simple at-home test to see if your blood pressure drops too low. Now, I want to share something very practical. This is a simple test many seniors have never been taught, yet it can reveal whether your blood pressure may be dropping too low when you stand. This test does not replace medical care, but it can give you valuable information to discuss with your doctor. Here's how it works. First, sit quietly in a chair for at least 5 minutes. Make sure your feet are flat on the floor and your back is supported. Then, measure your blood pressure while seated. Write down the numbers and how you feel. Next, stand up slowly. After standing for 1 minute, measure your blood pressure again. Pay attention to any symptoms: dizziness, weakness, blurred vision, or unsteadiness. If you can safely do so, measure it again after 3 minutes of standing. Now, here's what you're looking for. If your systolic blood pressure, the top number, drops by 20 points or more after standing, that may indicate your body is having trouble adjusting. If the bottom number drops by 10 points or more, that can also be significant. But numbers alone are not the whole story. Symptoms matter just as much. If you feel lightheaded, dizzy, or unsteady after standing, even if the numbers don't look dramatic, that's important information. Many seniors are surprised by what they discover with this test. Their blood pressure looks fine while sitting, but when they stand, it drops quickly. This helps explain why falls often happen in the morning, after getting out of bed, or after sitting for a long time. Another important thing to watch is timing. Notice whether symptoms happen shortly after taking medication, when you are dehydrated, after a hot shower, when standing up too quickly. All of these can worsen blood pressure drops. If this test causes severe dizziness, chest pain, or near fainting, stop immediately and sit or lie down. Safety always comes first. The purpose of this test is not to diagnose yourself. It's to give you clear, real-world information about how your body responds. If you notice large drops or frequent symptoms, that's a strong reason to talk with your doctor. You can say, "I feel dizzy when I stand, and my blood pressure drops when I check it." That conversation is much more helpful than simply saying, "I don't feel quite right." In the final part of this video, I'll explain when low blood pressure becomes dangerous, what warning signs should never be ignored, and how to talk to your doctor about safer blood pressure goals without stopping medication on your own. When low blood pressure becomes dangerous, and what to do next. Now let's talk about something very important. When does blood pressure become dangerous for older adults? Low blood pressure is not always a problem, but in seniors, it becomes dangerous when it starts to affect daily function and safety. Here are warning signs you should never ignore. Dizziness when standing, feeling weak or unsteady, blurred vision, fatigue that doesn't improve, confusion or trouble concentrating, fear of walking because you might fall. These are not normal signs of aging. Very often, they are signs that blood pressure may be too low for your body. Another red flag is frequent falls or near falls. One fall can change everything for an older adult. A broken hip, a head injury, or even fear of falling can lead to loss of independence, reduced mobility, and serious health decline. That's why blood pressure management in seniors must be balanced. Not too high, not too low, and never one number fits all. If you're over 65, your goal is not a perfect textbook number. Your real goal is staying steady on your feet, keeping your brain well supplied with blood, protecting your kidneys, maintaining independence and quality of life. This is why many experts now agree that slightly higher blood pressure targets can be safer for older adults, but never change or stop medication on your own. Instead, have a better conversation with your doctor. Bring your home blood pressure readings, results from the standing test, a list of symptoms you've noticed. You can say, I feel worse at lower numbers. I'm concerned about dizziness and falls. Can we review my target? That is a reasonable and responsible request. Remember this, feeling well and staying safe matters more than chasing a number. If this video helped you understand your blood pressure better, share it with someone you care about. Many seniors are suffering silently because they believe lower is always better, and that simply isn't true. Comment below. Too low, if you think your pressure may be too low. In range, if you feel comfortable with your current numbers. Talking to doctor if you plan to discuss this at your next visit. Thank you for watching all the way through. You now know the truth about blood pressure for older adults, and that knowledge can protect your health and independence.